Welcome to the Real Integrative Medicine podcast. I'm Dr. Jordan Robertson, and I'm here to bring you the tools, insights, and strategies to take your health to the next level while using evidence-based integrative medicine. What's real? This is what we want to explore together. Research is ever-changing and not easy to interpret. We're bringing you the best that integrative medicine has to offer while sticking to the facts. Our mission is to elevate the practice of integrative medicine for clinicians and patients alike. Preventative solutions, nutrition, exercise, and sometimes supplements have a seat at the table in medicine, but only if we uncover real science-backed solutions. It's time to uncover what works and challenge what doesn't. Let's unlock your full health potential with an integrated approach. Ready to learn what's real? Let's dive in. Welcome to another episode of Real Integrative Medicine. I am pretty jazzed about this conversation, not just because I'm interested in food and how food impacts your symptoms and the way that you feel, but anytime I can get in the room with someone who is as passionate about evidence-based naturopathic medicine as I am, like we barely got to hit the record button before we started, spouting off about all the things we're interested in and passionate about in integrative medicine. I'd love to welcome Monique Aucoin to the show today. Monique, thank you so much for agreeing to do the podcast and for us to be able to spend time together today.
Thanks so much for the opportunity. I'm excited to be here.
So I first saw your name, I think, when I saw that your paper had been published on anxiety and nutrition. And I think at that time, I at first sort of brushed off the study. I have to say, I'm admitting that as soon as I saw it, I brushed it off. And partly because when we publish things in naturopathic medicine, we're often talking about a single case report or someone's writing about this one patient. I always say it's like the one time at band camp kind of evidence that we often use in integrative medicine. But I kept seeing your name show up in my LinkedIn feed, in my social media feed. You were featured in a newsletter that I am subscribed to. And I was like, I actually have to look at this. Everyone is so excited about this paper. And I ridiculously haven't even sat down to look at it that hard. And I was so pleasantly surprised at the level of work that you are doing, the kind of research that you're doing, and the results that you got from this study. So I would love if you could walk our listeners through a little bit about your career journey, your decision to embark on this study, looking at specifically at anxiety and nutrition. And we're going to kick off that conversation so that our listeners can learn more from you.
Sure. So I can start with a little bit about my career. I'm a naturopathic doctor. I've been in practice for about 13 years now, and I wear the unusual hat of a clinician scientist, meaning that I have a private practice, but I also spend a substantial amount of time as a researcher as well, and the two really inform each other. So I'm a senior research fellow at the Canadian College of Naturopathic Medicine, where I'm involved in research and teaching. I'm also an adjunct professor at the University of Guelph, and I have a private practice as well, with a focus as well on nutrition and mental health. And so you asked sort of where did this start? Well, I'm actually going to tell you one of those my one patient stories, because it actually was the start of this journey that I'm on. So it was about 2016 that I saw a patient. She was a 17-year-old girl, came into my practice, and she had significant symptoms of generalized anxiety disorder and hypoglycemia symptoms. And when I asked her, what are you eating on a daily basis? She listed off white bread, pasta, gummy bears, cookies, fruit, white pasta, this whole list of simple carbs. And I thought, oh my goodness, this can't be this can't be helping these anxiety symptoms. So I got her to eat some more protein and some more fiber and some healthy fats. And sure enough, her self-reported anxiety symptoms went from 7 out of 10 to 4 out of 10. And then when I looked at the scientific literature, there was nothing that I could find about the connection between diet and anxiety, the connection between blood sugar regulation or dietary glycemic index and anxiety, nothing. And I said, wow, this is such a gap in the literature. This is something that I really feel compelled to address. So alongside, there's been this emergence of research on depression and diet. And that field has really accelerated in the past decade. They've made tremendous strides in understanding the relationship between diet and depression. But the field of diet and anxiety had really been kind of left behind. And so that case report, seeing that sort of firsthand, really inspired me to further try and advance our scientific understanding of the relationship between diet and anxiety. So I published it as a case report, but then it really inspired quite a lot of other work that's come since then.
So let's talk about this, like the study, the one that you, the most recent one that's been published. And I think that's so funny that you started with a case report. And I have nothing against case reports. It's just that, quite often they don't like turn into this bigger project that you have done such a great job of propelling forward. And you're right. It's, I don't know why there's such a lack of research on nutrition and anxiety. I would love to hear your opinion on that. But tell us about like the research that you did do. Like what was included in that research and who did you study?
Yeah, so the study acronym, lately now studies have to get a little catchy name. So it's called EASE-GAD, which stood for Eating and Supplementation for Generalized Anxiety Disorder. And it was the first of its kind to use, it used a combination intervention of dietary counseling plus omega-3 supplementation for the treatment of generalized anxiety disorder. So we recruited adult women who had moderate to severe generalized anxiety disorder, so pretty substantial symptom burden. And they had to have a suboptimal diet at baseline and a suboptimal omega-3 score. So they couldn't already be eating the diet that we were going to recommend, and they couldn't already have great omega-3 status. Turned out that wasn't really hard to find people with suboptimal omega-3s, but that's another story. So we recruited those participants, and the study design was a randomized waitlist controlled trial. So we enrolled 50 participants, and as they were enrolled, they were randomly assigned to either the immediate start group, who did the 12-week intervention right away, or a waitlist control, where they did a 12-week waitlist period and then completed the intervention. And our analysis then compared what's the difference between doing the 12-week intervention versus the 12-week waitlist. Because you always have to compare to what? What would have happened had we not done this intervention? And then during the intervention, they did 12 weeks of dietary counseling. It was bi-weekly, so 7 sessions, a combination of in-person and virtual appointments, where they were doing changing their diet. It was largely related to the Mediterranean diet, and then taking an omega-3 supplementation at the same time.
So they connected with someone like twice every other week. And what did they talk about in those appointments? Like how to do the diet or checking in around their compliance? Like what did that part look like?
Yeah, so I delivered the intervention for this study, and we met every other week. The first week was a lot about education, so we created a recommendations handout that talked about a series of recommendations related to things like increasing vegetables, increasing fruit, olive oil, nuts and seeds, fish and seafood, whole grains, water, trying to increase all of those foods that are consistent with the Mediterranean diet. So we presented them with these recommendations and provided a bit of education about why those particular recommendations were made, why those certain foods seem to be helpful for anxiety disorders. And then we got people to set a goal. So they got to pick from those recommendations what they wanted to focus on first. So they would say like, maybe let's talk about vegetables. That's something that I'm interested in working on. So then we would work on setting a really specific goal. So using that like SMART goal strategy, something very clear, measurable, realistic. We would talk about any barriers that could interfere with that goal. We would talk about strategies to navigate barriers and talk about their motivation and why it was important for them to work on this goal. And then at the follow-up visits, we would assess like how did it go with the goal. If people achieved their goal, we'd say, great, that's awesome, sort of celebrate that a little bit and then build on it, tackle a new part of those series of recommendations and build on the dietary change. If they didn't achieve their goal, then we look deeper into what might have been interfering and how we might adjust the goal or adjust our strategies of supporting them. So there was a really big emphasis on things like behavior change support. How do we set people up for success? How do we identify barriers that might be preventing them from achieving the goals? Because we know that human behavior is really complex, and even when people want to change their diet, it's actually really, really hard to make substantial, lasting changes in people's dietary habits.
Yeah, and I think that part, like that part of the methods of a nutrition study, I'm always so fascinated in, because sometimes we can treat the prescription around nutrition like we would treat any other prescription. Like, here is, your piece of paper with your
Go do the Mediterranean diet. Yeah.
Go do it. Yeah, go take these pills. Go do this like complicated and sometimes difficult or culturally different foods that we want you to try, and we'll see you in 6 months and we'll see how that turned out for you.
Yeah.
Where I think, like, both for clinicians and for patients, when we look at the successful nutrition studies and we look at the methods, most of the successful nutrition interventions at this point in time, and we've talked about this on the podcast before, have a specific coaching strategy where there is a human being that is helping them move along through the process so they comply and they get the outcome that they were looking for.
Mm-hmm. Mm-hmm. Yeah, so there was lots of accountability as a component, lots of individualization and personalized recommendations and support. It was very participant-centered, so helping them to identify what they wanted to work on. And then addressing barriers. So we talked about things like mindful eating, so not just what people are eating, but how and why. And I've looked sort of briefly at some of your other work, and things like looking at appetite and emotional eating. And we know that those are drivers of eating behaviors among certain populations. And so we worked on developing strategies with participants about what they could do to navigate the desire to eat in response to things other than hunger, and how we can again just look at those drivers of eating behaviors and set people up for success.
And what happened to them? Like, what did the participants notice over their 12 weeks of like support and trying to make change? And then they also had their omega-3 supplement. Like, what were the results at the end of the 3 months?
Mm-hmm. So because it was a pilot study, our primary outcome was feasibility and acceptability. So we wanted to see, could we even do this study? We had designed all of these eligibility criteria. Could we recruit people who met those criteria? So that's the feasibility. And then acceptability was like, would people show up to the sessions? Would they take the supplement? Would they make changes? Would they engage with the sessions? And how would they rate their satisfaction with the intervention? And so we found that it was feasible. We were able to recruit the 50 participants in 8 months, and it was highly acceptable. So there was a very high rate of satisfaction reported. People really enjoyed the study, and they felt that they got a lot of positive benefits out of it. So that sort of self-reported satisfaction was very high. There was a high rate of attendance to the session, high rate of completing the questionnaires, high rate of compliance with the supplement. Our secondary outcome was then to look at some of those questions that we were really interested in about the impact of the dietary intervention on anxiety. So we used the Beck Anxiety Inventory, where we assessed anxiety symptom severity, and we saw a reduction. So at baseline, the average score was 26, and at the end of the intervention, it was 11. So we saw about a 55% reduction in anxiety symptom severity over the course of that 12-week period, compared to a 9% reduction among the participants in the waitlist control arm. So that was really exciting. It was statistically significant, even after we adjusted for some confounding variables. We also saw some trends. It wasn't part of our formal analysis to look at these statistically, but there seemed to be some improvement in things like self-efficacy, people's confidence in their ability to make change, their diet, improvement in diet quality, improvement in quality of life. And then when we asked them about their experience, we got lots of positive feedback about the elements that they liked, about things like individualization, and they reported things like improved knowledge, that they were learning more about cooking, that they were cooking more at home. Lots of them observed things like physical health improvements, as well as kind of like a side benefit, that they also noticed other health benefits in addition to the change in mental health symptoms.
Amazing. I think that's so great. Yeah. And I thank you for explaining that whole like pilot study, and all of that. Cause I think sometimes, people forget that like we've got these like very serious and on purpose steps that we take research through. Mm-hmm. And I think that's a good reminder that when like a drug or something does finally make it to market, like it has gone through like quite rigorous testing by the time it gets there. But we try to, match the same level of seriousness around evidence for other interventions like supplements and nutrition. So to compare that against maybe like, listening to what's happening on TikTok, we go through this like very like serious and stepwise process to try and understand if something's working from a research perspective. So I appreciate that you just explained that so that people can understand like, what's included in even trying to study something like this. Why do you think it worked? Like, I'm curious about like what your, like, there's obviously background research that has suggested the particular parts of the intervention that you pulled together, but I also would just love to hear like what your, hypothesis is around why that strategy was improving the symptoms of anxiety in those people.
So we recognize that it's a complex intervention. So people were making the diet changes, improving their omega-3 status, but we also know that we were teaching them things like mindfulness. And in mental health, we talk about behavioral activation, helping people to take action for doing something to support their own health. We know that all of these things are potentially beneficial. So it's likely a whole range of things that contributed to the benefit that we saw. But I'm really interested too in the nutrition component and how nutrition might have improved mental health symptoms. And I think there are quite a few mechanisms that have been proposed in the literature. The ones that I'm really interested in are blood sugar regulation. So, that goes back to that initial case that I saw. Our brain relies on sugar and it needs it to function properly. When we have low blood sugar, our brain doesn't function well. We can all relate to that sort of hangry feeling where low blood sugar episodes result in emotional symptoms. And when people can improve their blood sugar regulation, it seems to improve mental health as well. So there's that blood sugar piece. There's also this whole microbiome piece that's really emerging again in the last couple of decades, that the bacteria in our digestive system contribute. They impact things like inflammation, immune activation, HPA axis activation. They directly synthesize neurotransmitters and other neuroactive substances. And they eat fiber. So the more fiber people are eating, the more diversity of plant foods in their diet, the healthier their microbiome. And that seems to be an important factor in supporting good mental health. There's also this body of research about inflammation and mental health, and how inflammation seems, in particularly chronic inflammation, seems to be a significant driver of mood and anxiety disorders. And when people can decrease inflammation, and we know there's lots of dietary strategies that impact things like chronic inflammation, that seems to be important. And then the last one I'll say is like neurotransmitter synthesis. So neurotransmitters, well, what are they made of? Amino acids. Where do we get amino acids from? Protein. So making sure that people have those building blocks. And we know there's cofactors in neurotransmitter synthesis, things like vitamins and minerals. So making sure that people have adequate amounts of these macro and micronutrients in order to support healthy neurotransmitter synthesis. So lots of mechanisms.
I don't know if this is you or not, but if you're a naturopathic doctor or an integrative practitioner who prides yourself on being evidence-based, but don't have time to stay up to date with the research yourself, I have a solution for you. I'd love to invite you to explore and join the Confident Clinician, the only integrative medicine clinical decision-making tool that helps get research from PubMed into your practice with ease. We have built out exactly what you need to be the most efficient in your work, to be the best in your community, and to save you those precious hours that you're spending right now doing the research yourself. Joining with our premium membership gives you access to unlimited AI searches, gives you access to all of our previous database content, as well as our upcoming year of live delivered modules. You can check out more in the link in the show notes. I would love to see you inside of our community. We're making a huge difference in the way that practitioners practice integrative care and raising the bar for evidence-based integrative medicine. I hope you'll join us.
Yeah, so many reasons why. And I think the thing that I find so fascinating about this particular intervention, and that I really want people like listeners to pay attention to, is that you tackled each of the recommendations like quite slowly, right? Because like it's interesting because when we talk about like the mechanisms by which we think nutrition is working here, it's like, well, this does this and this does this and this does this, and like that's all awesome, except that also sounds kind of overwhelming, right? Like when we're start talking about nutrition change, like there's the polyphenols, there's the olive oil, but truly the like practicality of putting this into place is actually quite simple, we'll say. As simple as dietary change goes, because the people like self-selected what they wanted to work on and then tackled their goals like technically quite slowly. Like how did they feel? How did the participants feel? Were they like, okay, and what else do I have to do? Like how did they feel about, you know, picking one goal and then trying to tackle that to its fullest before moving on?
Well, whenever I presented the goals at the beginning, I said, don't get overwhelmed. This is the big picture. This is what we're trying to work towards over the course of 12 weeks. We're not accomplishing this all this coming week. We're going to take this as slow as you need to and bite off sort of one piece at a time. So that was made really clear to the participants. And some people ran with it. There were some people who incorporated most of the recommendations like almost immediately, and that was awesome. That was a very small minority. There's others that, you know, they would add in a couple and then things would slide, and it was sort of an up and down, gradual zigzag process, and that was okay. And we just tried to like recognize that people had lots of other things going on in their lives and support them as much as we can in moving in that direction in whatever, you know, some people said, I hate fish, I'm not doing that. So we said, okay, fine, don't eat fish. You know, so like just really letting them lead. I did a course on motivational interviewing in preparation for this. And I so recommend that as a strategy for healthcare providers, because it's really about creating that balance between like guiding them, but also letting them really influence the direction so that it's something that they wanted to be doing.
Yeah, I love motivational interviewing. That's one of the things that we talk about a lot with our clinicians as well, because it's one of those skills you can add after the fact to your medical training, which I also find so fascinating. We have great evidence if we just give clinicians a couple of, you know, tools from that toolkit around motivational interviewing. It changes the way they interact with patients and their patients do better. So I find that so amazing. But what I was going to say is like I'm excited to watch the shift in nutrition literature to move from this very like almost patronizing prescribing that has happened in previous generations of, you know, looking at nutrition and mental health to personalized nutrition and individualized nutrition that was executed similarly to the way that was done in your paper. What I'm so interested in is what you think about the sort of the criticism around like complex treatment options being used in studies, and or like if everyone's having a different conversation with the study, are they really doing the same treatment, right? Like that application of a biomedical approach to nutrition literature doesn't really work that well. And yet sometimes, you know, the critics will say, well, this research can't stand up because it's not, you know, it's not cut and dry, and then not everyone ate all the nuts, right? Blah, blah, blah. Like, what do you think about that? Or what's been your experience navigating that?
Yeah, it's a hard field to study. I'm not sure why I picked such a challenging area to do research. Sometimes I question that because you're right, it's complex. And so in research, sometimes we look at things like intervention fidelity. So if we have like a multi-site study, you can have a component where you're assessing, are the intervention deliverers all following like the manual or doing it in the same way? So our study was just one site. In the future, we hope to scale it up, and then we'll be looking at things like the delivery of the intervention as something that we're assessing. It certainly is really challenging. And I think it's, I'm okay to move away from that sort of reductionist model. Like, we don't know exactly what helped. And, you know, for one person, maybe they ate more fish, and the other person who didn't eat more fish, maybe they ate more vegetables. To me, it doesn't really matter. The fact that they're moving their diet more in alignment with the Mediterranean diet, the fact that it's different is probably okay. I think this kind of has parallels to things like whole practice naturopathic medicine research. So are you familiar with whole practice research. It's where, the study delivers care, but in a way that's still consistent with real life practice. So there was a cardiovascular study that was done looking at whole practice naturopathic medicine care for people at risk of cardiovascular disease. And the participants met with a naturopathic doctor, and they received recommendations from a list of potential options, but it was individualized, and it was multimodal, which is really what we do as naturopathic doctors in real clinical practice. And the results were really exciting. They saw a reduction in cardiovascular disease risk, which is great. And you can't really pinpoint from that, well, which of the interventions worked? Was it the omega-3s? Was it the fiber? Was it the smoking cessation or the exercise? But it doesn't really matter. What we can say is that this whole system can have this outcome. And we can look at it in this way that's still really reflective of the real world. Because when we have RCTs that treat everyone the same, where we give everybody, one supplement, like recruit people with headaches and give them all magnesium, yeah, that's an interesting study, but that's not really reflective of what's done in the real world, where in naturopathic medicine, where it's often individualized, there's some assessment of the needs of that particular patient, and it's often multimodal. But when we look at things like whole practice research, we can capture that complexity and that individualization. And I think that's the same thing with this nutrition research, is we don't know exactly which component of it helped, but we can study that as a whole, which is really reflective of how it's done in the real world.
Yeah, I think that's, it's when we read like some of those, I call them like paternalistic or like whatever kind of studies where it's like, here's the thing, do the thing, we'll see in 8 weeks. Most people in those studies don't comply, right? Like the compliance rate on some of those interventions where the delivery is very biomedical, the actual compliance is like nothing. Like if we get success in trials that are built that way, it's a miracle, because we like slid them a piece of paper and we're like, go eat fish. They go home. They're like, but I don't like fish. And if those studies have positive findings, it's like a literal miracle because people didn't actually do it. And I love this discussion that's moving more towards behavior medicine combined with nutritional medicine, where it's like, can we move people towards a pattern of nutrition that has been shown overall, like whether it's observationally or what have you, to have a reduced risk of disease or even improved disease. And the what we're studying is moving the people towards the pattern versus handing them a handout of the pattern and saying like, I hope you do this, like good luck with that. I do think there's going to be so much more that we can learn as clinicians from this type of research, because I think clinicians are a little bit at fault here too, where we know the med diet's the right thing to prescribe, but the how is not something that we're given a lot of support in, right? If it's fine if the conclusion of the study was your patient needs to eat the med diet, but that doesn't give the intel that I want clinicians to have around, you know what? Meet with them every other week, pick a goal, talk about it, try and tackle it. Let's figure out their individual barriers. Like it gives so much more how on behavior change medicine when we run studies like this, because not only did we study the food, but we also studied the delivery of it. And that's part of what made it successful. And even if we never are able to tease those two apart, who cares?
Mm-hmm. Yeah. I agree.
I have a question just about anxiety in general, like as our listener, for our listeners, is that, with your interest in, nutritional psychiatry, do patients know, like from an anxiety perspective, like just to like completely shift gears, just because I'm curious about what you think about this, is how aware are patients that able to self-describe their anxiety, to even know to put their hand up to say, this is something I need to work on with my provider? How much have we normalized some of those thoughts and feelings and experiences versus how easy is it for patients to self-identify that they have anxiety? What's your opinion on that?
That's hard to say. I think I work with sort of a self-selected group who do identify as having anxiety. So I'm maybe less familiar with the more general attitudes or beliefs in that area. But I think overall as a society, there's been a massive shift in terms of decreasing stigma and people recognizing, I think there's overall more diagnosis. There's lots of discussion in that area. Is it because it's becoming more common, or people more comfortable talking about it or accessing care more often? But I think overall, people are, accessing therapy more readily and recognizing that this is something that maybe as a disorder, everybody experiences anxiety. Like if you're feeling nervous or worried about something, that can be perfectly normal in response to a situation. But the difference with an anxiety disorder is that it's persistent and out of proportion with the trigger, and that it's having some sort of negative impact on people's lives. So it's impacting their ability to function either socially or in their work or in their family. It's having some sort of negative impact. And that's where we see that divide between like normal symptoms of anxiety that everyone's going to experience at some point versus a disorder.
Yeah, I like that you brought that up, and you're right. That big distinction does draw like a nice, like a thicker line, right, between like, some situational, like, shoot, I have something to do that's big tomorrow at work and I'm feeling anxious about it, versus an underlying current of anxiety that's maybe even interfering with your ability to have regular day or to have engage in your relationships and whatnot. So you're right, that does draw like a nice thick line between just like the day-to-day stressors and more generalized anxiety disorder. I think what I like about this conversation around nutrition and anxiety is how hopeful it is for people who are suffering with anxiety, that their options are not as limited as maybe they sometimes can be presented as. I'm sure you've had patients that are, pleasantly surprised that there are things they can do in addition to medication to support the way that they feel. What have you noticed in your private practice in terms of like how people interact with like their conventional doctor and then the work that you have to offer them as well?
Yeah, so I think one thing that I want to emphasize is that it's not a like one versus the other. So in our study and in all the previous research that's been done, the intervention studies on dietary modification for the treatment of depression, in all of those studies, participants were eligible no matter what therapy they were doing. So in our study, about a third were taking psychiatric medication, about half were doing some sort of psychotherapy, and we added the nutrition component in addition to that. So it wasn't like a one or the other. It was people who were doing, whatever degree of treatment already, but still experiencing symptoms, we use nutrition as an add-on therapy. So it's not a one versus the other. I want to make that really clear. This idea of like hope, I think is really exciting. One of my missions is to get people talking about nutrition and mental health. The example that I always give is if somebody had a heart attack and they went and accessed care, somebody's going to probably ask them a question about food and nutrition. It might not be, great dietary counseling, but I think in most situations it's going to come up. But when my colleagues and I have talked to psychiatrists and we talk to psychiatric patients, the vast, vast majority will tell you this conversation is not happening in mental health care now. It is not on anyone's radar. When people are presenting with major depressive disorder or generalized anxiety disorder, no one's asking them this question, well, what do you eat? And, is it possible that might be a contributing factor or an opportunity for you to improve your mental health outcomes by optimizing or improving the food that you're eating on a daily basis? So that conversation is really not happening. And there's some hope, like there's some signs that this is going to hopefully shift, but that's part of my work is, researching how do we really understand the impact of food on mental health, but also taking the research that we have and how do we get it out there? How do we get people, psychiatrists, other mental health care professionals having these conversations, putting it on the agenda that this is relevant to mental health care, what we eat.
Yeah, it's right. As soon as you started talking about that, it made me think of, I used to go to a gym with a nurse who worked at a mental health unit, and the doctor that was running that mental health unit got on a tear with the research on supplements and supporting different mental health conditions. And every couple of weeks she'd come to me, she'd be like, oh, did you know that fish oil? And I'd be like, yes, we know that fish oil. And then she'd be like, did you know that NAC? And I'd be like, yes, we know about NAC. And it just reminded me of that because it felt like these two, like we were worlds apart, right? Having that discussion. And the doctor running this unit like had this revelation that there were these other agents out there that may be co-administered with psychiatric medication that may improve outcomes. And he was like having a heyday with the literature. And I was like, I feel like this shouldn't be brand new news. I feel like this just needs to be something that we're having conversations with all the time. But we both know that like there can be like more insular conversations happening around various ways of working with patients versus having that like collaborative approach. And I want conventional medicine to pick up and be as excited about your work as you and I are about your work. I think that's a great goal because it certainly would shift some of the burden. It would shift some of that care model to other people in the space, like knowing that we have this massive bottleneck of talking to this particular professional or this particular professional about mental health. If we were able to invite other people as part of that care team, and we had evidence that the thing that person was doing actually was going to improve their outcomes, like that's an amazing opportunity for medicine to have improved mental health in everyone if we can invite that process into, the standard operating procedures. What do you feel like needs to change in order for that to happen? Which is a very big question, I realize.
Yeah, no, I love what you said there. There's actually research that shows for generalized anxiety disorder, it's about 20 to 30% of people who receive effective, appropriate care and relief from their symptoms. So the vast majority of people we see are actually still being impacted by these symptoms. And some of it's that, just affect some partial effectiveness of the therapies. Certainly there's people who do benefit, but some don't. And then, like you said, there's huge issues with access. So some people would be interested in psychotherapy, but barriers like cost or wait lists can interfere. Access to professionals in certain communities can interfere with people accessing therapies. So if we can work on researching other strategies that can be used adjunctively with an effect on anxiety symptoms, then that's really exciting. We're also working on piloting a process for looking at cost, because when I talk to psychiatrists about nutrition and mental health, one of the first things people say is, nope, stop. It costs too much money to eat a healthy diet. My patients can't do it, so I don't even want to have this conversation. And like we're just tearing our hair out. Like, okay, no, that actually seems to be a misconception. In the first study that was done on diet and depression, they did a cost analysis where they looked at the cost of people's baseline diet and the cost during the intervention, and they actually saw a reduction in food cost. The researcher, her name is Felice Jacka, she's so funny. I've heard her call it like the peasant diet because they're getting people to eat lentils and brown rice. And in our study too, people talked about cooking more at home and ordering less takeout and eating less processed food. And although we didn't include a cost component in our pilot study, we've got some funding now, and we're working on pilot testing a process so that we can incorporate it in a future study and really clearly get answer that question about cost. Because, like you said, we know that our healthcare system is strained, and if we can understand the cost effectiveness of something like adding dietary counseling, then that can help potentially inform how this might be incorporated. So I think there's just lots more work that needs to be done in terms of replication studies, in terms of cost effectiveness. But my hope is that this work will lead to more recognition that nutrition professionals like naturopathic doctors and dietitians have a role to play in supporting people with mood and anxiety disorders. And that will lead to more access to those treatment approaches within mental health care.
Yeah, I feel like there's so many like unsaid parts of your work and how important it is that I'm glad that you called that out. And there's other pieces there that I think are important that, I think we can have the bias that people can't change when they're suffering with mental health, right? We can have this bias that giving an intervention that requires them to do something when they are feeling unwell or maybe incapable of doing something is not possible, right? We've got the cost component, which you just like beautifully dispelled there, that it's not more expensive for someone to work towards eating on the Mediterranean diet as far as we can tell at this point, but I'm sure your next study will give us even more intel about that. That the individualized component, and that like that the person doesn't need to do 100% of the intervention right out of the gates to build on and see improvement over time, where again, patients will often have the bias that if they're not going to do any part of it, they're not going to do it at all. And that completely dispels that sort of perfectionist mindset we can have around interventions, where if we're not able to execute it perfectly, then it's useless. This is like a beautiful example of how that's actually not the case. And it also shows that like in a relatively short period of time, in the pilot study, which I'm totally, acknowledging, that we are seeing the potential for positive outcome, where we're often talking with generalized anxiety, something with people have suffered for a very long time before they access care, and they're only partially responsive to the care they do get. And so imagine what would happen if in 3 months, with some slow, thoughtful behavior change and fish oil, we could have this kind of impact on people who are suffering. Like there's so many parts there that are starting to like disintegrate, I think, a lot of the barriers that we normally put up when we start to talk about nutrition and mental health. I want to call those pieces out, because that's a little bit of a read between the lines, but a very important one for people listening, and even clinicians who are listening, that this isn't something that can be overlooked and really should be incorporated into their practice right away.
Yeah, totally agree. And same thing. So like, as I've sort of hinted at this, but there have been several studies sort of similar to ours, but in a population of people with major depressive disorder. As I said, that field is a little bit further ahead. There are 5 studies that have done randomized controlled trials using the Mediterranean diet. And those findings were all consistent with ours, that we see significant reductions in that case, depression symptom severity. And the first of its kind, it was called the SMILE study. They recruited people with moderate to severe depression. So these are people with substantial symptom burdens. And still, those participants were able to make significant changes in their diet quality and see these impact on their symptoms. So again, you're right. This is another myth that that's perceived as a barrier, is that this patient population isn't able, like maybe doesn't have the motivation or the capacity or resources to make these changes. But in fact, the research really doesn't support that. And like I said, that study has been replicated a couple of times in different populations. The most recent one was in young men, so like early adulthood men, which is a population, again, that's like very low in accessing care, considered to be undertreated. When this intervention was provided to them, same thing, great uptake and substantial improvements in their depression symptoms. So the idea that this intervention might not be appropriate or acceptable to certain patient populations because of mental illness actually seems to be a myth.
I appreciate that so much. Thank you. What's next for you, Monique? Like, where are we at in your sort of world domination over the next couple of years? What's next for you? And I also would love if you could share how our listeners can find you so that they can stay connected with you and your work.
Yeah, so the next step for this project will be, again, this was a pilot study, so scaling it up, doing a larger replication study with a bigger sample size. We learned a lot in the pilot study, so refining that protocol and that intervention and replicating it in a larger sample. As I mentioned, we're going to add in a cost evaluation component because we really want to get a really clear answer to that question that seems to be perceived as a barrier. We also want to explore this question in other patient or participant populations, other geographic locations. So we're just in the step right now of applying for funding in order to expand that project. And in terms of connecting with me, you can find me on Facebook and Instagram. It's at Monique Aucoin ND.
Amazing. Thank you so much for sharing your work and your message with our audience. I really appreciate it. And we will put links to all of Monique's social connections in the show notes, so you can hop over there and make sure that you give her a follow so that you can stay tuned when her next big project hits the main stage. Thanks so much, Monique, for spending time with me.
My pleasure. Thanks for profiling this topic.
That's it for today's episode of the Real Integrative Medicine podcast. I hope you're feeling inspired, informed, and ready to make changes that truly support your health. If you found value in today's discussion, don't forget to hit subscribe, share this episode with someone who needs it, and leave a review. It helps us reach even more listeners just like you. Your health journey is personal and it's powerful. Let's keep building on the knowledge to give you the confidence you need to thrive. It's important to remember that the Real Integrative Medicine podcast is for educational purposes only. Be sure to talk to your doctor before making any personal health changes. This podcast isn't intended to diagnose you, and no doctor-patient relationship was formed by listening. We'll see you next week.